to another session of Neighbors and Friends. My guests today are from the School of Social Work here at the University, Jefri Palermo, and her guest, Loree Cook Davis. Loree Cook Daniels. And I will let Jefri do the interviewing because they did a workshop together and I was unable to attend the workshop. So, Jefri, I'll let you and Loree have your program.
Thank you.
Thanks. So yesterday at the Iowa City Public Library, we had Loree Cook Daniels and Michael Munson from Forge in Milwaukee
Right.
came and gave a presentation all day long on LGBT and aging. And Loree has been working in that field for many, many years, and I'm really delighted that she has agreed to come speak with us so that we can hear more about her efforts across the country and in Milwaukee. So, Loree, one thing that occurred to me yesterday was, I know you've been involved in the National Resource Center, and they've received a federally funded grant, and you're part of that technical assistance team. But as you travel around the country, what are you seeing? What kinds of activities are you seeing groups and communities doing to respond to LGBT aging issues?
Well, I think the thing that is most visible is that LGBT communities are putting together SAGEs, which are usually, the age range is not very fixed, but generally it's 50 and up for LGBT elders. And I think it's in the 20s now as to how many SAGEs there are. So they are networked with the National SAGE and get technical assistance and share information. So that network is really getting very tight and working really well. Another thing that I see a lot of is there's a lot of training going on of LGBT elders to do advocacy, federal advocacy, state advocacy, local advocacy, to actually get our issues in front of legislators. So that's another thing that I see.
That's great. But why do you think this is happening now? What is it about this issue that's come to the forefront of our awareness?
There are a couple of reasons I think it's happening now. One is just simply the baby boomer generation is now starting to cross the age 65 line. So there's a lot more of us, and we're more coming. So anyone that's aware of the demographic shift in the country is more aware of aging. I think LGBT issues in particular, our political time has come right now, and we're getting, with the gay marriage laws and with some of the things that are happening on the federal level, there's just a lot more awareness of what the LGBT community is and is doing, and I think there's a lot more permission for people to be out about being LGBT.
Well, yes, because LGBT people have been around forever and been aging forever, and certainly they're, being served, I assume, by long-term care providers and aging service providers. So, is there something wrong with the current system?
The current system has mostly been oblivious, which is nice in some ways. It means people are not actively discriminating against you because they're not thinking about you. But there are, and this was one of the things that we trained on yesterday, because of the lifelong history of discrimination against LGBT people, we end up with a lot of health disparities. And of course, the older people get, the more health issues they have. And so the older we get, the more our health disparities start showing up. So if the people who are serving older people are not aware of even the health effects of being LGBT in this community, in this country, they can't provide the appropriate health supports.
Okay. So tell me more about what is happening on the federal level.
What is happening? I actually started in aging when I was 16, started working at a retirement home. It's also the year I came out as a lesbian. So the two issues have been joined for me for 36 years now. I love talking about what's happening in the federal government level because I never expected, frankly, to live long enough to see a presidential leadership on this issue. And this president has, in fact, led. People are really focused on, they have been focused on Don't Ask, Don't Tell, which of course we've gotten rid of, and the Defense of Marriage Act. But those were not under the president's control. So what he has done is a lot of changes that didn't have to go through Congress. So for instance, he appointed an open lesbian as the head of the Administration on Aging. So our top aging federal official is herself a member of the community and is openly a member of the community and is openly committed to the issue. So when we now bring requests and proposals to the Administration on Aging, the door is open and the table's cleared. And to give you an example, there was a report done on discrimination against LGBT people in long-term care facilities. And my understanding is, I was not at the meeting, but my understanding is that Assistant Secretary Kathy Greenlee was kind of disappointed with the LGBT people who showed up because they didn't have their proposals ready. She was ready to act. What do we need to do now on this? And they kind of said, well, we need to think about that a little bit. That's how ready they are. Tell us what we can do. The Department of Health and Human Services has an LGBT coordinating committee. One of the other things that the Administration on Aging did was fund the National Resource Center on LGBT Aging, which is a coalition of 11 partner organizations, huge coalition to run a particular project. And those partners include some of the mainstream aging groups, like the National Association of Area Agencies on Aging and the American Society on Aging, and some of the key LGBT aging groups. It's quite amazing. There's a lot of educating within the partnership that's going on.
Even AARP now has its own
presence. Yes, they have a Pride, LGBT Pride webpage with multiple resources, and the last time I looked at it, they were keeping it updated, which is, I mean, sometimes people put something up and they let it die, and they're keeping it up.
So we finally got the ear of the government, and it seems like the things are moving along, and there are lots of things in the pipeline. What do you see happening? What do you think the next thing is, the next step?
Well, one of the things that's in progress that is, it sounds very esoteric, but it is really crucial. The Department of Health and Human Services and several other agencies of the government have committed to putting on the type of federally funded surveys that we get all our statistics from, and then on which government programs are based, are going to start asking about people's sexual orientation and gender identity. And what that's going to mean is that we can start having statistics issued by the federal government that shows our health disparities, that shows how many of us there are, that shows that we have needs for certain programs or that we're not accessing certain programs. And that kind of data is what Congress members want to see. They want, when we go to Congress and say we want this law or we want that, they always ask, well, how many of you are there? Which we don't really know. We've only got estimates. So when the federal government starts asking those questions, we're going to start having answers to give them.
So there's going to be some instantaneous visibility. They'll know.
Yes. Yes, there will be visibility.
And just like there started to be research done specifically on women's health concerns and health disparities, now they'll be able to make some decisions about what kinds of programming are necessary in order to address the LGBT community.
Right. For instance, we've begun to get really strong statistics on how many transgender people have suicidal thoughts and have attempted suicide. It's higher than almost any other group that's been measured. Well, what that's going to help us do is create depression awareness programs. It might help us get more healthcare coverage for transgender people, because it will become clear that in terms of minority stress, transgender people are really, really suffering. Mm-hmm. So that's where data comes in, is it allows us to justify our requests.
Mm-hmm. So yesterday we had a room full of people that represented a variety of agencies and organizations in the community. One thing that seemed to be lacking was a representation from the medical community. There were some nursing folks
Yes.
there, but as far as physicians, of course it was a Monday, but as far as physicians, do you see them as kind of frontline primary care providers that need this kind of training as well?
Absolutely. But I did elder abuse training for a long time, and one of the first reports that I did in the 80s on elder abuse in terms of educating professionals was, it was drilled into me that many professions will only take training from members of their own profession, and that was particularly true of physicians and law enforcement. So it's really, the training has got to come from within their ranks.
I agree. I was recently asked to speak to an internal medicine grand rounds group, and I said we need to find a physician to do that.
Yes.
Because I could stand there and nod, but they're only going to listen to hopefully an LGBT physician who is really well versed in those issues, and then they'll pay attention. Yeah.
Well, and you might appreciate this. There is a phenomenon everywhere. Every community is, the people that they're used to can't possibly be the experts. Yeah. So that is why you ended up having me come into Iowa City rather than you giving the training. You were probably just as qualified, but because I'm from out of town, people think I know more.
Well, and you do. You absolutely do. You've been at it a long time, and you know that credibility, though, of being part of that first nationally funded resource center, it goes a long way.
I'm very proud of that.
Yeah,
it meant for me. It meant that they were going to be serious about the transgender part of their commitment, because they know that I can be a pain in the rear end, and so they knew when they asked us to be a partner that we were going to hold them to a high standard, and we have.
That's great. I think that's just wonderful, because I do think, you know, you need all the parties, all the pieces together to really make it work. And
yes.
They may not get another shot. You know, I mean, it really needs to work.
Right.
So it's very exciting, and they're generating a lot of resources on their website, and they're, you know, getting the word out. I get emails all the time, and I'm really excited to see what comes next.
Yes.
The webinars, I mean, they're really putting out a lot of good stuff.
Yes. Part of our mandate was to create a resource center that's online that anyone can access. And I think that's particularly important for aging professionals, because my experiences, and this may reflect on the training that we did yesterday, is many people think, I don't need cultural competency training in this small little population. Until they're suddenly sitting with a client who's saying, I'm LGBT and I have this issue, and then they go, oh my gosh, I don't know how to handle that. So I do think we need to use the internet so that people can go to their web browser and look something up and get good information immediately.
Yeah, I was very happy to see the Geriatric Education Center represented there. We've worked with them to try to improve their resources, because they have access to the whole state. And this has obviously been something that's been missing. So when you talk about healthcare providers, I think Iowa City and the university hospitals and clinics has a stellar reputation as far as giving really excellent care. And so, you know, if somebody feels like, you know, they're well schooled, well trained to providing patient-centered care, why would they need anything more? I mean, why wouldn't they just automatically be able to focus in on what that individual person needs?
Person-centered care is a wonderful foundation. It is what a lot of cultural competency is looking for, because no culture has all the same kinds of members. So you don't want to think, oh, well, because you're LGBT, you're going to act such and such a way. So person-centered care is really good. And there are subtle cues that people give off that I'm not really going to answer your question fully because I don't think you're ready for the answer. And that's where the cultural competency trainings can start to come in. When you start knowing how much discrimination LGBT people have faced, including in a healthcare setting, you may notice the hesitation before they answer a question. You may notice something else that you wouldn't pick up normally that will tell you, I didn't get the full answer here, and maybe I could ask more.
So in essence, you're saying that so much is happening behind the scenes, under the surface, that you really need to be skilled and trained to look for those cues.
Yes, because we had a person in the training yesterday that said, well, we go down the form and we ask these questions. And LGBT people in general have trained themselves how to answer those questions safely, which doesn't necessarily mean that they're answered completely. So I don't know that always just going down the questions is going to get there. There has to be some rapport building. There has to be a sense that the provider, when I'm the patient, I need to know that the provider knows my kind of person exists. I don't want to have to be the first lesbian or the first bisexual or the first transgender person that they've met. I just don't want to take that chance.
Sure. And that's assuming that they read the form. I've been in many situations where you say it all on the form, and then they get into the room and they, now what kind of birth control do you use? It's like, why did I bother? You
Right,
know?
right,
Like,
right.
come on. So I don't know if you have a sense of this, but would you say that most LGBT people who are in long-term care settings or in nursing home settings are staying in the closet?
Most transgender people can't stay in the closet in an intimate care setting where people can see their body unclothed, because most transgender elders have not had all the surgeries. LGBT people, yes, I think that most of them are trying to keep themselves safe, not only from staff but also from other residents, and therefore not revealing who they are.
At their own
expense. Especially if you have a lifelong partner. I mean, can you imagine not being able to touch your partner because somebody might see you? I mean, you no longer have a safe space when you're in a nursing home. It's a public space.
Yeah. And what, as part of the Visibility Action Team, one of the responses that we got when we initially wanted to work on this issue was, well, that doesn't really happen here because we're so progressive and we've been, historically very inclusive and we've done all the diversity training, et cetera, and it's really not happening. It's not an issue. We don't have statistics. We don't have, we know it's happening. Why wouldn't it? It happens everywhere else.
Right.
But how do you respond to that?
One question, there's a possibility that they're right, and so I would be asking them, so tell me some stories about the LGBT residents you've had. If they're saying we've never had any, that's a different story. That is a different story. That means people aren't coming out.
Yeah.
Because it's just statistically, it's really, really unlikely that every resident they've had has been heterosexual.
Yeah. So if they have no policies for how to work with or care for LGBT folks, and they have no way of identifying their successes, then they're obviously in denial.
I would suggest denial was a good possibility. I don't want to say they're obviously in denial, but it's a good possibility. And there's some subtle things that go on that people don't they don't realize what they're doing. And I'll give you a personal example. It's not about aging, but I went in to get psychological testing for my son. And what they do in those cases is they go all the way back and ask you about the pregnancy. Well, I was not the pregnant partner. So I had to try and negotiate how I was going to answer her questions without claiming that I was the one who was pregnant. And of course, she was assuming I was the one that was pregnant. I looked female. So at some point, I had to say his father bore him. His father was a female to male transsexual. And at that point, she says, oh, well, I've heard everything, so this is not anything new. And I thought, well, we'll see about that. And sure enough, she said to me, so what's your sexual orientation? And I said, I don't have a sexual orientation label. And she's like, well, you have to. And I said, why do I have to? And she said, well, how am I going to describe your case to other people?
Oh.
And I was thinking, you're supposed to be evaluating my child. Why are you presenting my case and having to describe my sexual orientation? And so that was an example of, oh, well, I've heard everything and I'm very open-minded, she said. And then she was saying, I need your label, and if you don't have one, I'm going to put one on you. So there's some subtlety where people think that they're being really open-minded and not quite getting there yet.
Well, and so it sounds like we need to go that extra step and become more visibly inclusive in terms of, how we present ourselves as a service provider. But I think some people have fears that if you do outreach or if you advertise yourself as, LGBT friendly, that you're going to be taken over, or
Taken over?
taken over.
I wish.
Yeah, that we were that many in number.
Yes, yes.
That they're, somehow it's going to contaminate you or your service, and you're just going to be known as this organization that caters to, in quotes, LGBT people.
I have a really interesting experience that counters that. There is an LGBT retirement development in Santa Fe, New Mexico. It is very LGBT. I mean, it's kind of funny. They've named all of their rooms after well-known lesbians and gay men and transsexual people. It's very, very gay. It's decorated very gay if you believe in those kinds of things. I think their clientele is 25% heterosexual. Because that's where they want to live as well.
Yeah.
So I think even if the worst case happened and it became known as the place for LGBT people, there would still be heterosexuals that would be there.
Yeah. Yeah, I get that. And, when we did our survey, or we're still doing our survey of the LGBT community in Johnson County, many people said they'd like to be in a mixed environment, depending on who those people were.
Right.
So, they didn't have any problem, aging with heterosexuals as long as they were, their heads were in the right place.
Right, exactly. And I think that's why these heterosexuals are moving into this community. It has a real community feeling. It has a lot of artists. It has a lot of things that other people who are not lesbian, gay, bisexual, or transgender value. And I actually think that eventually we're going to get to where we do our groupings based on values rather than identities. It's just at this historical moment,
Yeah.
people are really, they need to know their identity is accepted.
Yeah, but hopefully we'll move beyond that at some point.
We will.
What? That's wonderful. I think that's my questions. Do you have any questions?
No, at the end of the program, John will put in captions the websites.
Okay, all right.
The SAGE group, which is the senior aging.
It's senior, it's now Services and Advocacy for GLBT Elders.
Okay,
They had to change it a little to get the T in there.
okay. Right, to be more, right,
Yes.
always looking to be more inclusive.
Yes.
And we'll put some websites like that on,
And the Forge website.
Okay,
Yeah,
that would be
'cause
great.
That's the organization that she is with.
that's right, Loree.
Uh-huh, uh-huh.
So we'll put those on the website and hope people can contact you. If you have a phone number, we'll put that on.
Okay, that'd be great.
And I thank you for coming, Jefri and Loree.
Yes.
It's been a delight listening to you.
Well, thank you very much. It's been great being here. I had a great time at the training yesterday. It's always wonderful to hear what's going on in other places. And I came with a colleague and we were both talking last night about how there's exciting work going on in Iowa City. So I want to commend you for that. I know you're one of the motors in that area.
The purpose of the program is to let the public know we're somebody's mother or father, we're somebody's brother or sister, and somebody's cousin, sister or brother.
Grandchild.
We're just part of the family.
Right.
And
Yes.
we're just different from the word go, but not that different.
Not that different.
We grow up, we work, we pay taxes like everybody else.
We want respect and care and inclusion, which is what everyone wants.
Right.
That's what everyone wants.
Mhm.
Thank you very much.
Thank you.
you.